Hi everyone. In our previous videos we've discussed what the pharmacy intern oral exam involves. Today let's talk about why some interns fail. Most candidates who fail the pharmacy oral exam do not fail because they lack knowledge. They fail despite knowing the guidelines, the drugs, and the conditions. In this video, I'll explain why knowledge is not the differentiation, and what actually causes competent interns to fail the oral exam. Every year, capable intern pharmacists walk into the oral exam confident in their clinical knowledge and still fail. That's because the pharmacy oral exam is not a test of how much you know. It is a test of whether examiners believe you are ready to practice safely. The pharmacy oral exam is a summative assessment developed by the Pharmacy Board of Australia and delivered by IHRA. Its sole purpose is to determine whether an intern is ready to practice safely and independently as a pharmacist. Not whether you can recall facts but whether you can apply judgment. The actual exam runs for approximately 35 minutes and consists of 3 parts. Primary health care, legal and ethical practice, problem solving and communication. On paper, this sounds manageable. In practice, this is where most candidates fall into predictable traps. Everyone in the exam room has similar knowledge. What separates a pass from a fail is how that knowledge is structured, communicated, and prioritized under time pressure. Examiners are not asking, "Do you know the answer?" They are asking, "Would I trust this person with a real patient?" In Part A, candidates often fail not because they don't know the condition, but because they don't consider the condition holistically. Misread flags. Overtreat or undertreat. Don't refer the patient correctly or use unsafe or ambiguous language. Examiners are listening for clinical judgment. They want to see that you can apply your knowledge to the patient in front of you. In the legal and ethical section, failure usually happens because candidates quote guidelines without applying them, focus on rules instead of patient safety, fail to articulate why an action is legally or ethically required. Knowing documents like the PSA Code of Ethics is expected. Demonstrating decision-making aligned with professional standards is what passes you. That's why our exam package includes a full mock oral exam conducted by a registered pharmacist. The mock exam is run under exam-style conditions, using realistic scenarios that reflect how the assessment is actually conducted. After the mock exam, you receive personalized feedback on how your answers were structured, how clearly you communicated, where examiner concern would likely arise, and specific changes needed to move from borderline to pass. This is not generic feedback. It is targeted advice based on how you perform, so you can correct issues before the real exam, not after a fail. Part C is open book. Yet it is where many candidates struggle the most. Common reasons include poor time management, over-checking references, missing the primary issue, failing to communicate clearly with the prescriber. Examiners are not impressed by how many resources you use. They are assessing whether you can identify risk quickly and act decisively. It's important to understand there is no fixed pass mark. Independent examiners assess whether you meet the standard for safe practice. Their judgment is based on patterns of behavior, not isolated answers. This is why more study alone does not fix failure. Candidates fail because they answer without a clear structure, communicate uncertainty in ways that undermine examiner confidence, miss what examiners are actually assessing, and fail to demonstrate safe, prioritized clinical thinking under pressure. In the pharmacy oral exam, knowledge is assumed. Judgment is what is assessed. Preparing properly means training how to think, speak, and structure answers in a way that aligns with examiner expectations, not simply revising content. Candidates need to practice prioritizing patient safety, using clear and logical answer structures, and verbalizing their reasoning so examiners can follow their judgment. This also includes learning how to communicate safely and managing time so the most important risks are addressed first. These are performance skills, not knowledge gaps, and they are rarely taught in standard revision resources. For example, when faced with a prescription problem, a weaker candidate may immediately start checking references or listing possible interactions without stating the main concern. A stronger candidate will first clearly identify the primary risk, explain why it matters for patient safety, outline the steps they would take to resolve it, and then use references to confirm details if required. Both candidates may have the same knowledge, but only one demonstrates the structured judgment examiners are assessing. If you want to understand what examiners are actually looking for and why capable, knowledgeable candidates still fail, preparation must focus on judgment, structure, and communication, not just memorization. You can explore our free and paid resources at pharmacyhouse.com.au to support your preparation. Check the link in the description for more information.